So first, when we come into forum, we obviously want to find the patient that we're dealing with for today. There's lots of different ways that you can search for the patient. The easiest way, if you are coming in and want to look for someone that has been seen on a different day, is actually just to type in the patient's name. So that's what we will do right here. So we're going to pull up a couple demo cases to go through with you. You can also search by a specific date of visit, and we can also search by patients who were seen on the specific day, within the last 2 days, or within the last week. When we find the patient that you want to review, you just double click on the patient and it's going to take you into the forum workplace, the patient chart for that date for that patient. Kind of navigating here just to get an overall sense of the capabilities and things that we can review within forum. On the right hand side, it will show you all of the different days that the patient has been imaged, and this was a feature added a couple years ago and is very lovely. But you can see exactly what imaging was done on those days. And if you want to look at just all of the days that OCTs have been done, you can click OCT at the top and it's going to show you each of those different encounters. Within each day, you will see a couple different things. Any reports that have been created will be there. You can also see the different icons. And if you have Glaucoma Workplace, if you have the Cirrus Review software also integrated, you can double click on these images and you can create new reports, or you can actually navigate through those different line items a little bit closer. So Glaucoma Workplace is probably my favorite thing about taking care of glaucoma patients. I don't know how I would see patients without Glaucoma Workplace. The first area that is new in the newest version of Forum is the progression summary. And so this will give you a sense of if data is showing any progression on either the visual field, the retinal nerve fiber layer, the ganglion cell over time. And so this is kind of a really nice screenshot, kind of summary view. We will actually go through this on the next patient so we can show you a little bit more detailed of how to utilize this a little bit more. The other areas within the Glaucoma Workplace that are really great to look at, very helpful, is the visual field GPA. This is going to show you the mean deviation. We are defaulting into the most recent encounter. So in this case, it was a 10-2 encounter, but we can navigate between the different types of visual fields that are done, especially if you've been doing different strategies, see to fast, see to faster on your patients. This is a great way to be able to look at them all together by using the mixed. So within the GPA, you're going to be shown the actual mean deviation change over time. You'll also be able to visualize very easily those two baseline visual fields and your most current field together. The next area, which I use all the time, is the visual field overview. So this is going to show you each of the different visual fields that you've done over time, and they're stacked. So the most recent encounter is going to be at the top, and we can quickly scroll through these and see if there's been any progression. You get a really nice sense of the patients. Within here, if you want to actually look at the specific field with more detail, you can just double click on it and it will pull you back to the typical report that we're all used to looking at on a day-to-day basis. We can also navigate here between the different types of visual fields. So right now we're looking at 24-2 and 30-2s combined, but we can also quickly, easily move over and look at our 10-2s fields as well right there. The next spot that I find really, really useful, especially in patients that have advanced glaucoma and we're switching between different target sizes, is to use the visual field browser. So this is actually fairly similar to the overview where we have access to all of the visual fields that have been done on the patients. But here we can see exactly which fields were done. We can see the strategy, we can see the stimulus size. And so if you have done size 5 targets or you're switching between any customized fields, this is going to be a really great way to navigate and look quickly through these fields. You can actually keep it so that it's synchronized, so that when we click on a different encounter date, it'll move both eyes to that, or we can unsynchronize the viewing, and that will let you look at the fields in each eye on different dates of service. So if you had a 24-2 one day and you did a 10-2 in the other eye that day, but you wanted to look at both of their 24-2s together, you can easily navigate to that there. So I will pass everything over to Lemma, and she will go through the structure function with you now.